Okay, we are recording. So I don't know if that pops up on your end that says we're recording, but we are recording. So hi everybody, I'm Sarah Clute-Bain. I'm the Boone County Hospital Foundation Director, and we are here today with our Educating and Empowering You program for the month of December. Hard to believe that the year is winding down. But I'm just really grateful that we have several doctors with us today, specifically for women's health. So as people continue to filter in here, we're just going ahead and getting started. We have Dr. Emily Zulick, who is with us, and I'll have you do more of a formal presentation of your introduction of yourself so that I get all the facts straight, and that way you cover all that. So we'll have Dr. Hay, Dr. Stevenson, and Dr. Lincoln Meyer here as well. We're just going to run through a little bit of information today. So no pressure yet from you, Dr. Hay. I'm going to have Dr. Zoulek just lead us off, and then I'm going to wait till all three of you of the family practice physicians are on and together, and then we'll go through you three. Is that okay? That's our plan, okay? Mm-hmm. So Dr. Zoulek, I'll turn it over to you. If you wouldn't mind just starting off by sharing with us a little bit about yourself and your title and anything that you would like to share about your area of work.
Okay, sure. So I'm Dr. Emily Zulick. I am an OBGYN that primarily works in Ames right now and just started doing outreach here in Boone in July. So we are currently coming 2 days a month on Thursdays. It's going really well. So a little bit about my background. I went to medical school in Pennsylvania and then did my residency training in Muskegon, Michigan, which is where I grew up. And that was for 4 years. And then I actually moved to Minnesota for 8 years, where I practiced in a small hospital very similar to the size of Boone, where I was either solo for part of the time or had one partner. And then just a year and a half ago, our family decided to move down to Iowa, where we knew some friends, and to be in a slightly bigger practice. And so now we're here, and it's going really well over the last 18 months. So now here we are doing outreach, and it's going great.
Awesome. So tell us a little bit about, if you wouldn't mind, just kind of what you're bringing to Boone County Hospital for women's health services for us.
Sure. So I practice a wide array of just general OBGYN. Mostly here in Boone, we're just focusing on gynecology because we have a lot of great OB care already in Boone. So just today, I did my first co-management consult of a high-risk OB patient, which we can do if patients are having some issues and just kind of need a second opinion about their pregnancy. But mostly we're doing gynecology, so anything that has to do with birth control, contraceptives, heavy bleeding, need for a hysterectomy or ablation. I do a lot of prolapse and incontinence surgeries, which is kind of like my niche over in Ames. But really anything that kind of involves female care, we can take care of.
Okay, excellent. So is there, you covered a lot of ground there as far as what all you are helping with women's health, but is there any particular area or specialty that you would quote, like say that you particularly have an interest in?
Yeah, mostly when it comes to prolapse and incontinence.
Okay. Mm-hmm. So can you tell us a little bit more about that in terms of what you typically work with a patient on in terms of prolapse and incontinence?
Sure. So, prolapse is more common in postmenopausal women, but it can kind of happen at any age. There's a lot of risk factors. So, anything that, is causing really patient discomfort or pelvic floor issues with their urinary or bowel system. So it's really kind of a lifestyle thing, really, when it comes to prolapse. Not many people get to the point where they can't go to the bathroom. But it's more of a lifestyle thing, and really when it becomes bothersome. And so we offer, pelvic floor physical therapy as a very early option, especially in young patients. Pessaries for patients who want to try to avoid surgery or really aren't surgical candidates, and then a wide variety of surgical options. All the way from doing a hysterectomy with a repair, open procedures with mesh, without mesh, and even to the point of like closing off the vagina. There's certain procedures in very elderly women who kind of aren't candidates for really big surgeries. So.
Okay. What can you tell me a little bit more about what pessary is? And I don't know if I'm even saying that right.
Sure. Yeah, pessary is a silicone kind of ring-shaped device. I always try to it's similar to a diaphragm. Not that many people even know what a diaphragm is, even more. Maybe a menstrual cup is more common these days, but it's kind of a firm silicone device that goes up inside the vagina, and it just holds everything in place. So it doesn't actually fix the prolapse. It just symptomatically treats the prolapse, and can be either taken out by the patient, or they can come in for frequent checks into the office, and we can remove it and make sure it's not causing any issues. But it's a really great option for people who have mild symptoms or just aren't surgical candidates.
Okay, that's great to know. Is there anything else, as far as before we kind of get into the details of how people would reach you to make an appointment? Is there anything else that you would like to touch on or speak to in terms of women's health, or anything you're seeing? I mean, especially like right now with the pandemic, if there's, all of those things kind of going on in the world, what would you say if there's anything else you wanted to add?
Sure. I mean, I think things are trying to get back to normal in the healthcare world, but who knows if this is probably our new normal. We're kind of back up and running when it comes to OB. We do a lot of our procedures as outpatient procedures now. Even 90% of our hysterectomies are sent home within a couple hours of surgery. So we're not delaying surgeries anymore due to the pandemic, unless people test positive for COVID. So really kind of getting back to the focus of taking care of yourself and not being afraid to come into the doctor is kind of key. But we're still doing a lot of procedures. People can go home same day, have quick recoveries. And I think it's going well.
Good. That's all really great to know, and I think for the community to be aware of as well. So if someone wanted to make an appointment with you, Dr. Zoulek, how would they go about doing that? What's your best way of reaching you?
Yeah, the best way still is to call the Ames office. And they will set up an appointment, whether it's in Ames or in Boone. They have access to both schedules, but it's all done through the computer system that they have through the Ames office, even to be seen over here in Boone. So.
Okay, so I'm sorry, I'm going to put you on the spot. Do you happen to have that phone number off the top of
don't.
your head? Okay.
I never call myself, so
that's okay. I understand. I will make sure that we get that posted with the information when we put this out publicly with the recording. So we'll make sure that people know how to reach you. So if there's not anything else you want to add, I'm going to shift over to our family practice physicians. That just worked out well for us to dive in with Dr. Zulick. And thank you so much for being here. And you're welcome to stay for a little bit if you're able to. And if there's
anybody has any questions, since I have to leave before.
Yes, that's a good point too. So Dr. Zulick has to leave probably in about 10 minutes. So are there any questions for Dr. Zulick at this time? You can unmute yourself or drop something in the chat if you'd like. This is always the fun part of the silence. We'll just wait and see. We'll wait and see if anybody comes forward. But otherwise, what I'm going to do is I'm going to switch you out of our presenter, or removing you from the stage, and see if I can get all three of our family practice physicians to the stage. So that would be great. Hey, look at this. I think I'm doing it here. So, okay. Well, thank you, Dr. Zulick. I'm going to shift over to the family practice physicians, and then we'll, if anything comes up, we have you for a few more minutes here. So So thank you, three. I know you're very busy right now, so I'm so glad that I got all three of you, plus Dr. Zulick, all on today. So it's very exciting. So Dr. Linkenmeyer, Dr. Hay, and Dr. Stevenson, I'm going to have you just each go through one by one and introduce yourself. Tell us a little bit about yourself, maybe your training, and just kind of what brought you here to Boone County Hospital or Boone community. And maybe I'll just start with you, Dr. Hay, if you don't mind.
Sure. So I'm Dr. Lindsey Hay, and I am originally born in Virginia, but then made it out to the West Coast, and did my medical school residency in Seattle, and then I did a rural family medicine fellowship where I was trained by a group of amazing obstetricians how to do C-sections and high-risk pregnancy and postpartum care. Then I worked with Dr. Stevenson actually in Port Angeles, Washington for a few years, and I followed her to Boone, Iowa. And after visiting her, we fell in love, and we thought this would be a great place to practice. And I'm really getting to use all the skills that I learned during my fellowship, and it's been great.
Wonderful. Well, we're so happy to have you. So with that being, saying that, we'll maybe go over here to Dr. Stevenson and have you introduce yourself next, and then we'll kind of just go round robin here a little bit. So do you need me to unmute you? Oh, I think I can just send a request to unmute. There, you're unmuted.
So yeah, I was originally born in Iowa and grew up in Minnesota. Went to school at University of Iowa for undergraduate, and then moved out to Montreal for medical school, and went at McGill University, and then came back to the Midwest for residency. I always kind of knew, I grew up in a small town in Minnesota. I always liked small towns and rural, so I kind of gravitated toward that throughout medical school. And when I went to residency, chose a rural training track. So it was in Baraboo, Wisconsin, and it was a small community, a small hospital. And I was obstetrics and do all my C-section training in residency, and then moved out to Washington just for fun, kind of out of a fluke, and worked out there for about 7 years or so. And there's a great group of doctors there. It was super fun. It was a small hospital. It was great, kind of exploring a whole bunch of skills, but ultimately our family was from the Midwest, and my husband's job is in agriculture. So eventually he kind of wanted to come back to the Midwest, and dragged me along with him. I did not want to leave Washington State, but when we got here, it actually worked out great. It's been great to be back in Iowa, be closer to family. And I feel really lucky to have landed in Boone County Hospital. I think the hospital here is great. And it's also just this great group of colleagues. It's great to have my kids growing up in a wonderful state with a wonderful education system and a wonderful town like Boone. It's just been a really good hospital and a really good fit. And then I was, of course, just delighted when Lindsey Hay rang me up and said that she was kind of looking for a change of life and was able to come out here with me, because it's really fun to have a friend come all the way from across the country and be ready to work with you. So my favorite thing about being in Boone is that we really get to do the whole range of activities here for a family doctor. We're not just working in the clinic. We're doing obstetrics. We're in the OR. We're working in the ER. We're also working on the med surg floor. So we really get to walk through with patients through whatever they need in life. It's a lot of my own patients that I happen to be in the ER working a shift when they come in with whatever issue, and it's really fun to see all the familiar faces in the community and in different parts of the hospital.
That's wonderful. And I think you kind of alluded to this, but it sounds like maybe that's something that's special to Boone County and being able to be here, is that you're able to provide that kind of variety of services with a patient versus maybe when you were in the bigger facility. Did you find that was not the case?
Yeah, well, I'll be real clear. I've never worked in a very big facility. I've always worked. I mean, when we did like medical school, I worked in a big city. But for most residency, I did my training rural. I've worked in small towns, been a rural family doctor. So it's always been kind of the thing that I've done. But also really special about Boone, a lot of rural towns are kind of the towns themselves are dying a little bit, and the medical community is dying out. And Boone has been really vibrant despite that. You know, you don't have to go far to realize that Boone is still a really vibrant town with a lot going on. There's a lot of activity within the town, and the outdoor activities here are great. So I think that the town is vibrant, and as a result, the medical community is also very vibrant here too. Lots of communities in Iowa have shut their doors in obstetric services, even some of the bigger towns. And we just have a thriving family birth center here. The same with our OR. You know, we have a lot of interesting cases and specialists coming through. So I think Boone is just a thriving hospital. But I've always been working rural and done kind of the full gambit within my job. And I wouldn't want to have it any other way. And so I felt really lucky to come back to the Midwest and be able to find a town like Boone that was both a thriving Midwest town and had this thriving medical community as well.
Wonderful. I just appreciate all that you said so much, and we're so grateful to have you. So I'm going to move over to Dr. Linkenmeyer, let her introduce herself, and we'll kind of, like I said, keep going round robin here just a little bit. So you're up, Dr. Linkenmeyer.
Hey, so thank you. Hello, I'm Kate Linkenmeyer, and I am the newest hire here at Boone. I originally am from Northeast Iowa, so I grew up a farm kid, and then I went to Iowa City for medical school, Ames for undergrad, and then Iowa City to med school. I did my residency training at Broadlawn. That's the community hospital that's in Des Moines, Iowa. Loved my experience at Broadlawns. You really get what we call full spectrum care, caring for patients, inpatient, outpatient, caring for moms, caring for babies. And to me, that was a huge draw to Boone, is you get to care for a patient in every aspect of their life and every aspect of their care. And that was really important to me. And I think that's one of the huge benefits of Boone, both as a provider, but also as a patient, that you have that familiarity with your doctor, and that you can just feel well taken care of right in your own town. One little so my path to medicine kind of was a detour because my undergrad career was in psychology, and I was wanting to be a school counselor or a counselor, and just something was always missing. So I actually worked in that field for a few years, and it's still something I'm really passionate about, but I just knew that something was missing, and that's what led me to medicine, and have always been really passionate about women's reproductive health. And so that's why I'm glad to join such a great team of OB docs and gynecologists here in Boone. So.
That's great. Well, so is it fair to say, I mean, you're bringing a mental health component too? I mean, I'm sure every physician has mental health training, but obviously you have a little bit more perhaps with that background. Was that a fair statement?
Yeah. Oh, yeah. And it's just something I've always been really passionate about. I mean, that was one of my first passions, was counseling and mental health. So, yeah.
Sure. Wonderful. Well, we will come back to you. So, Dr. Hay, I'm sure after hearing your colleagues speak too, you probably want to maybe share a little bit more about, like, you know, what your passion is with women's health, and what areas you really kind of, I don't know if you want to call it specialize in, or just something that creates an extra special interest for you. Do you want to tell us just a little bit more about that for you?
Absolutely. I think family medicine, we're sort of specialists in recognizing that things are normal and when we need help. And I kind of see ourselves as that for our patients, is we're a really good first step to determine, like, oh, that you really do need a gynecologist right now for this. And we really need another pair of eyes on this situation. And so things that I really enjoy doing, I've really enjoyed doing lactation support and breastfeeding counseling for my patients. And I feel like as a family medicine doctor, kind of have that unique opportunity to see moms and babes together in their visits. And over at our hospital in the Family Birth Center, we have two fantastic lactation specialists that have just, it's been fantastic to work with them and really been able to support a lot of moms. And then I love contraception. I think that's been something that I've always had a big passion about, walking through people options that they have, and to be in charge of their fertility, and something that brings me a lot of joy to help out.
Yeah, to have them have those choices available, right? That's excellent. Well, I'm going to continue to move on here. Is there anything that you would like to add, Dr. Stevenson, about any specialty areas or I know you were able to share with us about really honing in on the rural healthcare practice and anything else specific to women's health that you'd like to share.
Yeah, for sure. One area of interest for me is substance abuse and mental health issues in pregnancy. I think I really appreciate what Dr. Hay said about knowing sort of, where does a family doctor, people wonder a lot of times, like, should I see a midwife? Should I see an obstetrician? Should I see a family doctor? And I think one really good role for family doctors in terms of pregnancy care is when you have what would otherwise be, a relatively low risk pregnancy, but have a lot of other medical conditions going on. Sometimes people, like the pregnancy itself is fairly normal and healthy, but, they're either having trouble with alcohol abuse or methamphetamine use or something like that during pregnancy. Or, maybe an opiate addiction and need to be on Suboxone. And they end up sometimes with a lot of subspecialists involved, like they see their psychiatrist and then they have their addiction management doctor and they have their obstetrician. And sometimes the communication is really fluid between all the providers and sometimes it's not. And I think one of the nice things about family medicine is that, you can sometimes have the opportunity of somebody who treats a lot of opiate addiction and maybe is your Suboxone provider, prescriber that, also can help you care for the pregnancy and can walk you through that process of how it would look. And then can also sometimes take care of the newborn and know a lot about your history and kind of know what to expect. If there's going to be some, issues with the baby, maybe having some withdrawal symptoms and how we might treat that and walk through it in, a really non-judgmental way, especially if we know the patient well and know their background and their situation well. A lot of people, have trauma or reason in their past that they kind of ended up with addiction issues, or sometimes they don't, but just addiction is really complicated, and having that opportunity of somebody who knows you and knows your background and can kind of follow you through that process can be a really good experience for people if they've had disjointed or trouble with that care in the past.
Mm-hmm.
I think a really nice opportunity, and something I'm really passionate about is giving people a safe place to come for treatment of their addiction issues in pregnancy. There's tons of judgment around that. People feel like, if you're pregnant, you shouldn't be drinking alcohol. And I don't disagree, but of course, saying that and doing that is two totally different things, right? Like it can be really hard to stop drinking just because you're pregnant. I really think it's a really special opportunity to be there for patients and help them through that process at whatever level they're on.
Wow, you all are doing so much in so many different areas. It's really just incredible that we have this type of care right here in Boone County Hospital and in our community. So thank you for that. And I'll jump over to Dr. Linkenmeyer to give you the opportunity also to share a little bit more about what you're wanting to contribute more to women's health in that realm.
Yeah. So like a lot of what they've echoed, right? So I think all of us identify how crucial mental health is and how much pregnancy and the hormonal changes that go along with that can impact mental health. Just like Dr. Hay said, I think information and resources regarding reproductive choices and birth control options is really important. And then another area for myself that I'm really passionate about and kind of goes along with my counseling is something called trauma-informed care and trauma-informed exams. So I, unfortunately, am very experienced working with people who are the survivors of sexual or domestic trauma, and I really incorporate principles that I've learned from my other experiences into how I provide care and how I do my exam. And then another just kind of random thing that I'm really interested in is vulvar skincare and vulvar skincare guidelines. That was something that I had the opportunity in my medical school training to work with some of the specialists at University of Iowa with that. And it's just something that some guidelines have been ingrained in me, and I think it's really important.
Okay, that's excellent. And definitely some things that help us just understand a little bit better as women too, that sometimes we just don't even think about. And I think that from speaking my own experience of just being a woman and going through pregnancies and going through all the things that we've gone through as women, we just don't always talk about it. And I think that having a safe place, like with each of you, to be able to ask questions and talk about openly about these things is just so very important. So Okay, one more time, round robin. Let's just head back here to Dr. Hay. If there's anything else you wanted to add, I mean, truly, I think you're all contributing some wonderful information for us. We'll give an opportunity if anybody has questions to jump into the chat or unmute. I think we're pretty informal here as far as that goes. But Dr. Hay, did you want to share anything more about what we're talking about? I'm sure as you kind of go through this cycle, there's more stuff that comes up. Oh, I want to say this. So go for it.
I just feel so lucky, and I'm so glad that I work here with the people that I do work with, because, you know, physically, Dr. Lincoln Meyer and Dr. Stevenson and I are like within 10 to 15 feet of each other most every day of the week. And so I have these resources at my fingertips to get my patients the best possible care. So if there's something that I do really well that they need help with, like, or they want me to see one of their patients so we can optimize something, right? And, you know, so we can all provide all of our patients with whatever needs that, you know, sort of arise. And I'm just glad that I ended up here, and I'm so excited that Dr. Linkenmeyer is with us, and she, you know, and it's going to be wonderful. So we hope to have people come and see us and let us help them, you know, get the best quality of life that they can and walk with them.
Yeah, and so that actually brings me to just kind of this last point with you also, is that as people obviously are listening to you, this is women's health. It's not just, you know, you're not obviously just OBGYN providers. I mean, you're able to deal with everyday kind of issues with people if they have a sinus infection or anything like that. So are you accepting patients of all issues, so to speak, not just necessarily women's health or OBGYN?
Yeah, absolutely. And I think that I think that's the nice thing about family medicine is you can come in for your OB appointment, and if you've got something else going on, then we can, you know, make an appointment for you to address those other things. I can't tell you how many times moms come in and they're like, he has never seen a doctor. He needs a doctor. You have to see my husband, or grandma comes, or we're going to switch all 4 kids over to see you too. And, you know, and I do think, like, if the whole family has access to good health care, it elevates everyone. And I think all 3 of us are really good. We don't shy away from those hard, tough questions or finding out and getting to know our patients. And it turns out some things are better once you start to really address them and dive into them, like with all the mental health stuff we talked about, you know, in light of the pandemic. You know, I don't think any of us shy away from those tough conversations. And we really hope that people think of us as like we're the first place they want to come when they've relapsed, when they've find that, like, gosh, maybe I am drinking more, or I'm more anxious than I thought I was, or this is really becoming a problem. And we want to be that safe medical home for people. And I think that, you know, what's really nice is when I go on vacation or I'm out of the office, I know that I've got this incredible backup of 2 other doctors that we see eye to eye. We practice, you know, so similarly. And when I'm gone, I know that my patients are getting incredible care and that we have really good communication so that it makes for this fluid transition between each other. And it couldn't be more ideal.
Excellent.
Yeah.
I just appreciate that so much. And again, just to reiterate that it's just so wonderful to have that type of care in that home here that people can go to you all. So, and Dr. Stevenson, if you want to share any final kind of thoughts here on women's health / accepting patients for any type of issue. Well, not maybe any type, but you can tell us a little bit more about how, your approach on that.
Yeah, I think it's ideal when I get to see the whole family, or you know, I like to have a diverse patient population, people coming from all walks of life. So I think that's one of the really fun parts about family medicine, is being able to see newborn babies and people who are 100 years old in the nursing home. I think you really get the idea of all the things that come across people's lives. And I love to see the older people in my practice and get some of their wisdom. And also the vibrant young families are fun too. So I think that's the best part about this job, is you really get to see the different things that people bring to the table. I also think I love that we're doing this presentation just to get the message out there that just because, you know, I think people get this idea like Boone is small and Des Moines is big. And I think just because we're smaller here doesn't mean we're less good necessarily. You know, maybe there's some surgeries or whatever that they offer in Des Moines that we don't do here, but especially with Dr. Zulick joining Boone County Hospital, we really offer a huge range of surgeries. We have a wonderful family birth center here with lactation consultants, and can really provide excellent obstetric care. The nurses up there are absolutely fantastic and would just bend over backwards for all our patients. And you get a lot of really personalized care when you go up there because we're small. You're not going to walk into some labor ward with 50 other women in labor where you're just a number. People really get a personal connection up there and really care about you and your baby. And it's a really personalized approach. So I hope people from the community and from the surrounding area come here and get to experience how good it is over at Boone County Hospital, because it's a really good medical team.
Excellent. Well, I can definitely speak to the care that I had when I had my child 14 years ago at Family Birth Center. It was wonderful. So I definitely can attest to that. So, okay, Dr. Linkenmeyer, you're up again. Kind of the same thought process of anything else you wanted to add about, you're obviously you're new, so you are definitely taking patients, and what types of patients you'd like to take. And I mean, obviously, just go ahead and share with us what your thoughts are.
So as far as the patients I like to see, kind of like bring it on. I'm open to anyone. I have lots of availability. I think that's great. I see all ages. Something that's really important to me, and I think it's kind of important to all family doctors, is just in our specialty, is we really recognize ourselves as kind of a medical home. And if you need specialists, you'll get specialists, but just knowing that we kind of think about all the systems, all the person as a whole, and so we can kind of tie that all back together. Yeah, so I'm open to all patients. And then also, I just want to add that you're exactly right. I am new, but I feel very lucky that I'm coming to a place that already has these two fantastic docs. And I just think I'm happy for our patients and for my future patients, because this is the team. And so if I'm not on, I just know that any patient I have is going to be so well taken care of. And it just makes me so happy to know that we kind of all have these same priorities and thoughts and passions about patient care. And I feel very at ease knowing that my patients are always going to be well taken care of here with this team.
Wonderful. Well, I'm elated again that I got you all together today. I know it was kind of like we had to rework it a couple of times, but I'm so glad I got the opportunity to bring you all on. We're recording this, so we're going to be able to send this out to the community, have people hear your voices, see your faces, hear you talk about all the things that you're doing within your practice. I don't know if any of you listen to the podcast with Brene Brown where she does like speed questions at the end. I won't do that to you today. But if there's anything you wanted to add, here's your final chance to like just toss it out there. If there's something you wanted to add before we do sign off. I'm not seeing any questions coming through in the chat. And if anybody does want to ask a question, please feel free to unmute or put something in the chat. Any of you have any final thoughts? Your favorite song? Oh, TC. Oh, yes. Which clinic are you at? So that's a good question. I wanted to actually end with too today was just how people would set up an appointment with each of you. Are you all in the same clinic?
Yeah, okay. We are all at the North Clinic, which is the one right across the parking lot from the hospital. So it's easy to find some people get lost, in fact, if they're trying to get to the hospital and wander over to the North Clinic. It's the same one that the Walkin clinic is in, which is very familiar to people. And you can call the main phone number at the North Clinic is 515-432-4444. And I love it that it's a really easy phone number. So it's just 432-4444.
Perfect. Thank you for adding that. That is an easy number to remember for sure. Maybe we should just end on one quick question about you mentioned the walk-in clinic. So at what point do you suggest to a patient to go to the walk-in clinic versus setting an appointment with you? Do you mind answering that for us, Dr. Stevenson?
Yeah, so that's a great question. Usually we tell people, if it's business hours, give us a call. We can usually work you in. So we try to work in all of our patients for same day access. Occasionally, someone will call it 4:15 and the last appointment spot is 4:30 or something like that, and it's not going to work. Or the other time would be after hours care. Sometimes maybe you pick your kid up from school and they've got something going on, and you don't want to wait till tomorrow, like you feel like they should be seen that night. So that would be a good opportunity for the walk-in clinic as well if we're not open. The other thing is just right now it's a little bit goofy with COVID and the respiratory clinic, which is a new process, and the rules change a little bit every week. So I hesitate to put anything out there because it will probably have changed again by the time we finish recording. But currently, if we think a patient has COVID, we're trying not to bring them into the family practice clinic. And the current rules are, if they've just been seen, for example, at the walk-in and respiratory clinic, they had a negative COVID test, the patient's vaccinated, and we think it's something else going on, we'll bring them into the family practice clinic to be seen. But if they call and they're like, I've had a cough for 2 days and now I've got a low-grade fever and it sounds like COVID, we're trying not to bring them into the family practice side because we don't want them to mingle with other patients. We're doing our best from a public health standpoint not to spread this any faster or further than we can. But we tell people anytime, call, talk to us, talk to our nurses. Our nurses can answer and triage all those questions. So if you're not sure, should I come into family practice or should I go to the walk-in clinic? That's a great moment to just give us a call. I mean, obviously if it's crushing chest pain or you are bleeding out, please call 911 or go to the ER. And if you're really not sure which one, feel free to call us anytime. Our nurses, that's what they do. They triage those phone calls and try to guide you to the right location. So.
Excellent. Thank you for that. Anything else from Dr. Hay or Dr. Linkenmeyer before we close, or any other questions?
No.
Okay, excellent. Well, again, I'm super grateful for your time today. Hopefully you get a few minutes to eat some lunch before you're right back to it. We will get this recorded and sent out for the community to watch, and we'll send it to you as well. So thank you so much, everybody, for being here today, and have a wonderful holiday season.
Thank you. Bye.
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 Bye.